Dr. Anderson, thank you for an awesome discussion today about AI in orthopedics and really in medicine. It was a really good kind of review of what's kind of happening across the spectrum. I like how you started out by talking about the recent advancements in technology, talking about basically fire for lighting was really up until the 1900s. And then after that, that's only the time we've really seen other forms of lighting as far as technology goes. Where do you think the future of AI is going in medicine with everything that you've seen and with this kind of idea in mind?
I think the future is very bright. I think it will be transformative. There'll be a lot of things that AI will help us do better than we currently do in clinical practice. I think formulating differential diagnoses, for example, as a clinician, helping consider what all the possibilities are that a patient could have when they come in with a set of symptoms will be revolutionized through AI. I know myself, I'm pretty limited in the scope of things that I routinely think of when I see something, but I know I miss things too, and so I think this will actually improve diagnostic accuracy significantly.
I know that a lot of times we refer to our experience in medicine as a practice, right? We practice medicine.
They call it practice for a reason.
They exactly right. And so one of the issues I think that in the past that physicians have had difficulty with is changing their workflow, changing their way they do things, because they were trained by a certain surgeon that did it this way and it seemed to work for them. So doing that, and sometimes it's difficult for surgeons to adapt to some of the changes that are happening. What difficulties do you see with medicine adapting and kind of physicians changing their practice model with adding AI to it?
Well, I think physicians, as you point out, have historically been kind of resistant to change. But we've undergone a major transformation in my career from going to paper charts to electronic charts. And that was incredibly disruptive at the time and continues to disrupt medicine enormously. All the documentation requirements and coding requirements of feeding that machine, as you would want to think of it. But then you have the great benefit from a patient standpoint of potentially having your medical record being easily shared with lots of physicians in different specialties. That's just one great benefit. And also another great benefit of it from the standpoint of a patient is that when you do electronic ordering of things, for example, AI can help check the orders to make sure you're not ordering something that competes or interacts with another medicine or would cause a problem with the particular medical condition you have. We see that already in best practice alerts in a lot of the electronic health records.
So as we continue with HIPAA and the concerns that we have with patient data and information, and now we're adding recording with AI technology, so you can see how some patients may be a little bit nervous or hesitant. Obviously, some will embrace it openly. What would you tell them with everything that you've seen so far to kind of dissuade some of those fears and concerns that they might have?
That's a very good question, and I don't know that I have a great answer to that. The technology is a bit frightening because it's so overwhelming, what we can see that its abilities to do. I think that's probably one reason why people are concerned about AI in general, is that just how smart is it? Hard to assess. It keeps getting smarter, it seems like, with each iteration. I know that Jeffrey Hinton, the guy that I talked about, who was the father of AI, was very concerned about it in that 60 Minutes special that I alluded to, that AI is actually smarter than we think it is already.
I know one of the fears as we look at robotics and orthopedics, which obviously that's something that I have a passion about, and robotics in the world in general, a lot of people are getting feared that AI is going to be taking over and taking care of our jobs. And as physicians, obviously, that's a worry about that we don't want to lose our jobs because we have a computer model that does it. What are your thoughts about some of those fears that people have of being replaced by AI?
I certainly would share those fears. I think that particularly in a specialty that primarily you don't work with your hands, you work with your mind. I think AI can be a bit frightening. It's not unique to medicine. All white-collar jobs, I guess you could say, face the same existential threat, really, from AI.
Mm-hmm.
and I don't know how to alleviate that. I think that so far we've been able to have AI augment what we do. Having it actually replace what we do, that'll be a bit of a transformation, but I wouldn't be surprised if it happens in areas where it can make a genuine improvement.
And I like that you talked about the study that was done with orthopedic surgeons. The Chat GPT took the in-training exam for orthopedic surgeons and showed that it had a 73% passing rate, which is...
It got 73% of the answers right.
Right, not passing rate, sorry. 73% of the answers right, which was interesting about that study because I read that as well, and it did show that there was a good amount of residents that actually did better than that 73%. Now, it wasn't statistically better, but there was a good number that did better, which to me gives me hope that there is still benefit to obviously physicians. And you had brought up also the point that in orthopedics, kind of using AI in surgery, not just with some of the language-based AI that you talked about, but in surgery that we can see a benefit to it. And we're already seeing that as we do our hip replacements, hip and knee replacements, are creating these AI models that as surgeons it gives us information, or it's learning from how we like to do it. Frequently when I'm talking with patients and they'll go, oh, well, the robot's doing the surgery, and I'll have to explain to them, no, the robot's assisting to help me do the plan that I want. And now I can even change that to say, no, the robot's assisting me to do the plan that the robot and I came up with, and we can enact that. And I think that's kind of the big thing for me as I think about some of the fears that patients have that robot is doing surgeries and taking away the human aspect of it. And I don't think it is. If anything, it's making us better.
Well, that's the whole point. It is there to augment our jobs to help us perform better. And it will, as you point out. It has and it will continue to do that.
And we've started trialing it in our office where we're doing our notes, where the AI is actually listening to our conversation, which has been nice because I click, record, and then I turn my back on the computer and I face the patient the entire time. At the end, I push stop, and then I walk out and I go see my next patient because the note's been performed.
And that's really transformative, because otherwise you're trying to deal with all this technology at the same time you're trying to engage and really have a conversation and understand what the patient's telling you.
Yeah, so with your experience, you'd mentioned the change from going from paper charting to electronic medical record. What difference did you see there that potentially could, or improvement did you see there that potentially we could also expect or should give us hope with introducing AI in our clinic?
Well, the most basic was legible charts. Doctors' handwriting, of course, notoriously bad, and so that just took care of that problem immediately. We also saw some great benefits in terms of it being able to do medication checking to make sure what the medicines you're prescribing don't interact with any other medications that the patient might be on, or be harmful to the patient because of a condition that you hadn't really thought of.
Yeah. So I think that your talk was awesome. I think it's very timely. Right now we're seeing a whole bunch of change.
There's a wave of us just beginning to hit. It's just going to be staggering what the next decade will bring.
Yeah. Well, awesome. Well, thank you. Appreciate it.